America's healthcare system needs serious reforms, but the answer isn't socialized medicine. Here are 3 reasons why. Number 1, not only is socialized medicine not free, it's actually very expensive. Vermont Senator Bernie Sanders' Medicare for All bill would cost over $32 trillion over 10 years. And like other free government programs, Sanders-style socialized medicine will be anything but free for the roughly 70% of working American households who would pay more in taxes than they do today. Number 2, like everything else, you get what you pay for. And with socialized medicine, that means both medical professionals and patients will get less. For those in the medical field, it's important to note that Sanders' proposal relies on cutting compensation for medical services by 40%. While I don't believe most people choose to become doctors or nurses just for the paycheck, I also know that one of the only ways to cover the bottom line is to reduce your services if you have to reduce your cost. And this is exactly what you see happening in countries with socialized healthcare. 82% of doctors in the British National Health Service said their workplaces were understaffed. Perhaps that is why over 50,000 non-urgent surgeries were canceled earlier this year when the system was overwhelmed by flu season. Number 3, one thing you can count on in socialized healthcare systems is long waiting lines. This year, over 15% of patients in British emergency rooms are waiting over 4 hours before being seen. And if you are seeking treatment without going to the emergency room, you'll likely be waiting over 18 weeks. This is a 35% increase from 2017. And keep in mind, the British National Health Service has been around since 1948. So it's not as though they are just now experimenting with how to make the system work. And you see a similar trend with our friends on our northern border. In 2016, Canadians waited an average of 5 months for medically necessary specialist treatments. That is more than twice the average wait time in 1993. In fact, when compared to 11 similar countries, including the United States, a recent study shows that whether it's emergency room visits, same or next day appointments when you're sick, seeing a specialist, or getting elective surgery, Canada's wait times are the worst. Maybe that's why almost 60,000 of them visit the U.S. or other countries for medical care each year. Yes, America's healthcare system does need fixing, but there is plenty of evidence that socialized medicine, including the left's free Medicare for All, is not the answer.